Hello, my dear friends. Dr. Beddinghouse here. I have a wonderful person to interview today, Dr. Robin Pfaff, who is a national board certified health and wellness coach and a certified fibromyalgia coach. Boy, that's a big topic. She's also a licensed psychologist, and she has her doctorate in education in counseling. And her passion over the years has become helping women, especially women with fibromyalgia, get in touch with this issue that causes so much suffering. So I'm going to welcome Dr. Pfaff here to join us. Hello there.
Hello, Dr. Beddinghouse. I'm so happy to be here with you today.
Yeah, I know. We've been talking about this for a while, and now here we are. We've been doing these live interviews over the last year quite a bit, but recently we kind of dropped off, but we're trying to gather and so that we can talk to so many wonderful people in our community who are serving people. And you are in the Denver area, right?
I am.
Okay, well, maybe let's start by you telling us a little bit about how you got started in your career in counseling and coaching.
Yes, I was a psychotherapist for over 25 years, and we moved from southern New Mexico to Denver in 2016. And I
Hmm.
started looking for work that I could do from home. At the same time, I was struggling with my own fibromyalgia. The move and an injury at an exercise class put me into a fibromyalgia flare.
Mm.
So while I was looking for resources to treat my own fibromyalgia, I found out about a program for training of fibromyalgia coaches through the International Fibromyalgia Coaching Institute. So I did their training program, and I also did a health coach training program through Well Coaches. And that set me off on my new career of coaching women with fibromyalgia.
You know, uh, uh, Robin, can tell us a little bit about fibromyalgia? There's so much mystique around it. You know, I don't know that we know everything about it, but we certainly know the kind of symptoms. Can you just tell us a little bit about that from your own personal experience, I guess, too? Okay.
Sure. Fibromyalgia is kind of a mysterious illness because the causes are not well defined. It's considered generally to be a central nervous system disorder
Hmm.
um, that causes widespread chronic pain. It also has some symptoms of autoimmune disease. The major symptoms, the big four I like to call them, are unrefreshing sleep, the chronic widespread pain, the mild to moderate fatigue, and then cognitive impairment that's known as brain fog.
Yeah. Okay.
So it impacts every aspect of a person's life who has fibromyalgia.
Yeah. And who is more likely to have this complex of symptoms? Can you tell us about that?
Mostly women,
Mm.
mostly women, as indeed most women, it's mostly women who have autoimmune disorders. Fibromyalgia affects about 2 to 4% of the population. Men can have it as well, and also children and teenagers. But the vast majority of people with fibromyalgia um, come down with the disorder in midlife, and they're mostly women. And in my work, I primarily work with women who are 50 years and older and better, I like to say.
Yeah, I saw that. Yeah. So, does hormones have anything to do with it? Because that's around the time of menopause.
Yes. In fact, my own personal journey with fibromyalgia, I had symptoms since childhood,
Really?
but
Okay.
I was able to manage the pain and other symptoms until I hit early menopause in my early 40s, which
Mhm.
caused pretty severe insomnia. And that's what triggered my full blown um, fibromyalgia. Eventually, I was able to get that treated through bioidentical hormones and a lot of other lifestyle changes and so forth. But
Okay,
yeah,
so you had already been working in the psychology area as a therapist for quite a while until you started having these issues. Is that what triggered you to want to find out not only how to help yourself, but to help other people?
yes, yes. I had managed to do my psychotherapy practice because I was only working part-time, thanks to my husband supporting the household.
Hmm.
So I would do my psychotherapy practice a couple days a week, and I would spend the other time recovering. So I was sort of in the closet with my fibromyalgia. I didn't talk about it with anybody because I didn't see that there was anything positive to come from those conversations.
Yeah, it's really difficult when people come to see the doctor and your symptoms are not vague to you, but when you're trying to report them to a healthcare professional, it's kind of like, it's not like my left knee hurts, it's like I hurt everywhere.
Right.
So,
The symptoms are hard to pin down. And
mhm.
when you think of it as a systemic disorder that involves the entire nervous system, then it makes sense that the symptoms kind of move all around the body and affect all different types of organ systems. A lot of people with fibromyalgia also experience things like IBS and
Yeah.
arthritis, sometimes lupus. There are a lot of, we call them the evil sidekicks that go along with fibromyalgia.
Yeah, I must admit I'm not an expert on fibromyalgia, so I'm glad we have the opportunity to speak with you. But is there any research in whether or not this could come from a stealth infection that one might have had earlier in life?
Yes, there is. And, with the research that's been doing on long COVID, it's shedding some light on fibromyalgia and chronic fatigue syndrome because for some people, indeed, their illness was triggered by an infection or a virus. Another big trigger for fibromyalgia is trauma and stress. Um, a recent research study found that 57% of people diagnosed with fibromyalgia also meet the criteria for post-traumatic stress disorder.
Mm.
It's as if the body, whether it's triggered by a really stressful work environment or a car accident or an illness or surgery or childhood trauma, it's as if the body gets stuck in that fight or flight or freeze mechanism. And the system somehow gets stuck and develops into what's sometimes called central amplification disorder, pain disorder. It's as if fibromyalgia turns up the volume on the sensation of pain in the body. And so the entire body becomes more sensitive to everything.
Yeah, I know. The thing that always impresses me about these kind of dysfunctions is how everything is so interconnected.
Yes.
And it makes it hard to go back to the one underlying thing because many times it's several things and all the things that you've said because we know that stress is a mediator for so many things. It just kind of it's like it unplugs the immune system to go haywire. And
Yes.
yeah, and I so tell a look. Okay, there's so many things we could talk about here, but when people come to see you, tell us a little bit about your approach. I mean, you're a coach. You're trying to help them make changes that are going to help them feel better, or what?
Yes. Yes. I really love the health coach approach
Yeah.
because it empowers the person to take charge of their health. And when you're dealing with a complex disorder like fibromyalgia, that's really important. So, when I start with a new client, I get a pretty thorough history of their experience with fibromyalgia and any other chronic illness that they may have. And then we put together a wellness vision, which focuses on what they do want in their life, not what they don't want. Because just having less pain is not a big enough motivator for people to make significant changes in their life. But when you find out that they want to have less pain so that they can get down on the floor and play with their grandbabies, or
Yeah.
that they can hike in the woods with their favorite furry dog companion, or they want to be able to travel with their husband or their friends in retirement. Now that's a motivator. And so we work backwards from, what do you want in your life? If you were feeling better, what would you be doing? And from there, we set a series of goals. But with fibromyalgia, I like to call them micro steps, because it's very easy to overdo it in fibromyalgia. We call it the push and crash cycle, because if we get a good day, we want to catch up with everything we missed out on.
Yeah.
And we tend to push, and then that can cause a flare, which means an overall increase in symptoms. And then it can take days or weeks to recover. So we set micro steps, trying to find that sweet spot where we can increase our functionality without causing a flare.
Yeah, and that is so important, no matter what the condition is. I find that in my work. I think I used to be really gung ho. Okay, let's get this show on the road and do this. And I realize that, people can or won't do that. So we do have to take baby steps.
Yes.
So can you give us an idea of some of the things that you suggest for people to do?
Well, it's really individualized, Dr.
Yeah.
Beddinghouse, but health coaching goes just hand in hand with a functional medicine approach,
Yeah.
because we're focused on a holistic approach, the entire individual, not only their physical health, but their emotional well-being, their social support, their spiritual well-being. And so I like to start with an easy goal, something that they're almost already doing, and solidify that and pair that with something a little more challenging. And some of the things that we tend to focus on are adding more movement into our lives as fibromyalgia people. Because when a person is in pain, it makes sense that you just want to rest and be on the couch, but that ultimately is going to be counterproductive. But if you push too hard, you're going to end up on the couch
Like,
anyway.
No,
So,
it's like,
yeah, gentle exercise, moderate walking is good, warm water therapy classes, swimming is good. And then we also look at having a healthy diet that's focused on whole foods. We look at creating a set of habits to support restorative sleep, because that's a big issue for people with fibromyalgia. We look at reducing stress and bringing in mindfulness, and we look for strategies to reduce brain fog. So it runs the whole gamut.
yeah, boy, and speaking of coaching, I think, any helper, whether you are in the healthcare profession or whatever, coaching is so important because we all need it. We
Mhm.
need that person who's standing with us, who is supporting us, kind of like cheering us on. Hey, yeah, you can do this. Let's just do it a little bit at a time until we get to where we want to be. So I certainly, I've always said, I think every functional medicine doctor should have a coach working with the patients. I try to do that myself, but sometimes you need almost to have that filter between the doctor and somebody else who I think people think, oh, the doctor doesn't understand me. So, which
Well,
is not really true, but anyway.
right, right. I like to say that the doctor or the healthcare provider tells you what you need to do, and then the health coach helps you figure out how to do it,
Yeah.
because it's not easy to change habits. If it were easy, we would all do it. It's not easy, it's difficult. And there's so much going on with fibromyalgia. It's like we referred to earlier, there's so many layers. It's like peeling an onion. And so, as a health coach, I come alongside the person and help them work through that process and help them actually implement the treatment program that their healthcare provider has suggested for them.
Yeah. So it's very important. It's called collaboration, which God, is so important. It's so lacking right now in our healthcare system or our disease management system. So, what when somebody picks up the phone and calls you, and we'll put your contact information in there
Mhm.
of how they can. Tom, why don't you go ahead and do that, and then we'll put it up and see if anybody has any questions. But um, this is a question I have. Sometimes in my practice, I see a lot of women in this age group who are a bit overweight.
Mhm.
Do you see that a lot with your
Yes,
clients?
yes. A lot of
Okay.
folks with fibromyalgia carry extra weight, definitely.
Tom, you put that in such a thing, it's hard to read that. Okay. Well, anyway, that'll be in the information too. Go
Thank
ahead, and
you
I'm
very
sorry,
much.
interrupted you. So
That's right.
it so that and they come in almost defeated, don't they?
Oh, yeah.
Like I can't I can't lose this weight and I can't feel good. So I mean, you can't solve that problem immediately, but how do you deal with somebody like that?
Well, again, supporting a treatment program that their doctor has provided, helping
Mhm.
them incorporate gentle, moderate exercise into their life, and then help them move towards a healthier diet. Those are the things that we focus on.
Okay, and so in your training, you have some nutritional training, I'm
Sure,
assume, in
sure.
your health and wellness coaching that you've done. And did you do that before you started doing work with fibromyalgia, or did they kind of go hand in hand?
They kind of went hand in hand. Yeah. Yeah,
Okay.
I continue to do, training in lifestyle medicine, which is, supports a functional medicine approach, um, and bringing, all of my experience as a psychotherapist to the coaching experience is really helpful. Often my clients say that they've never really talked to someone, a professional person who also has fibromyalgia
Right.
herself, and that's very validating. And when my clients feel validated, then they can relax a little bit
Yeah.
and experiment and try some things, because a lot of coaching is improvising, and we'll set up an experiment and say, well, let's try this week and see what happens, and maybe it works and maybe it doesn't, but it's all good, because if it doesn't work, then we've learned something, and if it does work, then you've added a tool to your toolbox, which is something that is a metaphor I use a lot with my clients, that we're creating a toolbox for managing their pain and improving their sleep and reducing the brain fog and managing fatigue, so that they can feel like they have a set of resources that they can go back to again and again, so that they can gradually see improvement in their symptoms.
Yes, I agree with that wholeheartedly. What is the one thing that you find the most successful in just dealing with a patient? That every patient is different, but what is the one thing that you think works more often than not? I guess I would say to get them. You got to give the patient a little bit of success so
Right,
they won't give up. So
right. getting
Well,
some success going for sure. And I take my clients through a mini self-compassion online retreat that's based on the work of Dr. Kristen Neff, which focuses on the practice of self-kindness and recognizing that we, in our common humanity, everyone suffers, and that just being with what is going on and not resisting it is very healing, because we've found that it's there that we don't necessarily have control over the experience of pain, but we have control over our reaction to it. And what
absolutely.
we resist persists, and what we resist causes suffering. And so that's one thing I work on with my clients, is reducing that suffering through cognitive behavioral strategies and mindfulness strategies and self-compassion strategies, so that they feel more in control. I like to say that um, they control their fibromyalgia rather than having it control them.
Absolutely. It gives them hope.
Yes, so it's basic. It's
Yeah. And it's like,
for getting for healing.
and so with you having your own experience with this and the things that you have done that have made you, that helped you, and you share that with somebody, that gives them hope.
It
You know,
does.
I'm not the only person out here. And I think a lot of uh, patients who come to see me who may not have fibromyalgia, but they'll have symptoms that nobody can pinpoint
Yes,
into an ICD-10 diagnostic code, which
right.
we try to move away from because it doesn't tell us anything really about the
Mhm,
person.
mhm.
But they want somebody that believes them. You know,
Oh, right.
you've got to establish that sense of trust. I hear you. I believe you're suffering from this, and we're going to try to work and find ways to get out of the suffering. So okay, I think this is phenomenal type of work, and it's much needed. And it encompasses everything: the mental, emotional body, the physical body, the spiritual body, so that we can release people from this. It's almost like a prison that they've found themselves in, so they can't live their life in the
That's
way.
right.
And I like the way you start out by saying, okay, we know you want to get the pain under control, but what would happen if that pain was, what is the big goal?
Right,
To
right.
take that cruise with my spouse to Alaska and not have to stay in my cabin all the time?
Exactly.
Yeah,
Yeah.
that people can relate to, you know?
I call that the big why. And
Yes,
then, there's yet another level to this healing process, which is really rich in that it turns out that there are hidden gifts to dealing with a chronic illness like fibromyalgia,
absolutely.
and that a person's sensitivity and suffering, a lot of my clients want to use that to help other people as they start feeling better, and they start moving from post-traumatic stress into what's called post-traumatic growth, which is um, the experience of learning from a really difficult experience and coming on the other side of it with a greater appreciation for life, for a deeper sense of purpose in life, and a desire to give back to their community in whatever way they're called to. And so it's really delightful to see my clients move from a place of, as you mentioned, defeat and discouragement and suffering into, it's like going on a journey.
Yeah.
Sometimes I liken it to climbing a mountain where, and we have 14ers here in Colorado, so it's a metaphor that we can relate to. Sometimes you lose sight of what your goal is when you're climbing the mountain. But if you have a guide, a coach beside you who's been on the way ahead of you, the coach can say, just keep going, because you're close to the summit, you're close to feeling better. And it's really a delight for me to see my clients reverse that downward spiral of symptoms into a positive healing spiral where they're feeling better, they have control over their symptoms, they're able to accomplish the things that are most important to them, and then to take it to that greater level of post-traumatic growth where they're giving back. They're transformed through the process of healing.
Absolutely. That's the gift. You
It
know,
is.
sometimes we're presented with something that seems impossible to
Yes.
overcome. But if we can stay the course, the gift out of that will come. And
Yes.
sometimes you have no idea what that is going to be.
That's right.
But as far as when I think about it as the gift is you, the real you, and your sense of purpose in the life and what it is that you have to give to the world.
Exactly.
And boy, that's a big thing. And you know, Robin, there's so much suffering going on, no matter what we call it. It's suffering is suffering, but how do we help people? And I think that is so important. And I greatly appreciate your wanting to take the time to share this with me. And I want to see now, is there any questions, Tom, that people have or anything we need to address? I heard no. Okay, so what's the first thing somebody should do if they want to at least talk to you?
Sure. Well, you can go to my website at drrobinpfaff.com, and Tom is putting that contact information in the chat. And I have a lot of resources there, and there's also a link to schedule a free, what I call breakthrough session with me.
Is that a self-assessment?
There is also a self-assessment that you can request. It reviews the 4 areas of wellness that I mentioned before: the body, emotions, social support, and transcendent spirituality. And then there's also a link on my website to schedule a breakthrough session, which I just mentioned.
That's a get started one, right?
Yes, that's
Okay.
the Get Started link. You can go to my calendar, schedule a time, and we'll get on a phone call or a Zoom call. And what we do in that session is we review your experience with fibromyalgia. I let you ask any questions you have of me or my work with fibromyalgia coaching, and then we put our heads together to decide on a next step. If I think I can help you, then I'll suggest how you can work with me. If I think that there's another resource that might be helpful to you, I'll give you those resources as well. In fact, I gave your name to a client or a person I talked to just yesterday who lives here in Lakewood and was looking for functional medicine resources. So I'm happy to provide those resources to local people. And because I'm part of this larger, it's actually an international organization, I can work with people all over the United States, Canada, Australia, England, wherever people are speaking English. And we often have contacts all over the world of functional medicine practitioners and other providers that can be helpful to people with fibromyalgia.
Now that's everybody working together for the good of other people. It's amazing. And I guess one good thing that came out of COVID is that we can now talk to people all over the world.
Yes,
You know?
that's
Man, I
a
guess
big benefit, isn't it?
yeah, and it gives us an opportunity to rethink what we're doing, you know, so that we're working for the greater good of everybody. But
Yes.
you know,
And
Robin, this is so great. I really appreciate your taking the time. And for those of you who were not able to attend, you'll be able to see this shortly because it will be on the Facebook group, and share it with people. Share Dr. Pfaff's contact information with somebody that you know may be suffering from this, what seems like sometimes mysterious condition called fibromyalgia, or sometimes anybody who just needs a coach. So,
yes.
again, I appreciate it very much. And if there's no further comment or any questions, I guess we'll sign off for right now. Okay.
Thanks so much for having me.
All right. Take care.
You too.